I think I want to say a couple of more things. I'm going to talk about. I want to talk about the subset analysis and including the PD-L1 positive and the lymph node, because that's part of this presentation, and the sites of metastatic. So I'm going to say that. Okay. So we did a few other subset analyses within the ambassador study. So we had previously presented PD-L1 status based on combined positive score of 10 or greater being positive. And we found that, again, that in this extended DFS follow-up, that the PD-L1 positive patients prognostically did much better than the PD-L1 negative patients. But both groups benefited from adjuvant pembrolizumab. We also looked at the lymph node status. We wanted to know whether it made a difference in terms of adjuvant pembrolizumab versus observation. And we saw that, again, the lymph node status was very prognostic. If you have no lymph nodes, you do better. If you have an N1, you do worse. If you have N2 and 3, you do worse. And that was true for whichever primary tumor it was. We did see it a little bit more prominent in patients with bladder primaries. But regardless of the lymph node status, patients benefited from adjuvant pembrolizumab. Another thing that we looked at was the distribution of metastases. The patients that are having the recurrences, where are the tumors coming back? And the locations that the tumor were coming back are the lymph nodes, which could be in the chest, in the abdomen, or in the pelvis, the lung, the bone, and the liver. Those were the most common. And there was slight differences in the distribution based on observation or pembrolizumab, and that's hypothesis generating. So very interesting.